What I'm showing you here is a flexor tendon repair splint. And the purpose of this splint is for post-flexor tendon repair. And the goals of rehab for this would be to prevent re-rupture of that healing tendon, to increase the tensile strength of that repaired tendon, to limit scar formation that limits tendon excursion. And this is a dynamic splint. It assists in attaining these goals by maintaining the hand in this protective position. And that position is usually about 0 degrees of wrist extension. And the MCP is between 70 and 90 degrees of flexion. There's a dorsal hood, and that allows the full IP joints to allow that full extension. And then there's forearm straps. One palmar strap across the palmar distal crease, and that actually is a fixator there in this demonstration. It's a hard fixation, and a hard fixation at the wrist to prevent any flexion of the wrist, since the surgery for my patient was across here. So he is going to flex and extend, and allows just the right amount of motion. And there's a hood. The splint should be worn continuously. And so after the repair, the rubber bands that are attached to the nails of the finger with the suture through the nail, or it could be with a hood held in place with glue. So this splint is designed to minimize pull on the newly repaired tendons, and in the early stage of repair, consistent pull or stretch on those repaired tendons, if you look again, could result in poor motion. So I would request the patient to wear this splint 24/7, except for the designated times that I would ask, or I would do any dressing changes. And again, this is the flexor tendon repaired splint.